How many people out there have unfortunately had a family member or themselves been dealing with Alzheimer's disease? Alzheimer's disease has been around for decades with unfortunately really no great treatment. Medicines like Aricept just have not moved the needle, and other lifestyle changes just have not measured up to in terms of how to help these patients who unfortunately just have issues with memory decline, lifestyle issues, sometimes an inability in terms of processing conversations, sometimes an inability eventually just taking care of themselves. What the good news is there are a lot of new insights that are coming out in terms of other various causes of what Alzheimer's is, how we can address them with a combination of one or two medications that do show really good efficacy, combining that with looking at some other ways of treating those patients, combine that with lifestyle changes, combining that with some technologies that are coming up, and trying to develop a full program for these patients, attack things initially, not wait for things to worsen, and also provide help as quickly and as strongly as possible to try to treat the causes, to provide hope for the patient, obviously, as well as their family. So here we go. The list of what may cause it is up in the air. We know that it could be from accumulation of tau proteins. There's some potentially now attributing to damage to the mitochondria, which is the energy part of your cell. Maybe due to inflammation in the brain. It may be due to some infections, anything from Lyme disease or exposures to heavy metals. That is still being evaluated. It may be an issue in terms of abnormal insulin or higher insulin levels. That has led to some research in some diabetic medications like Mounjaro or Ozempic or Wegovy being helpful, and there's some preliminary data showing that it may be. There's maybe not one specific pathway that causes Alzheimer's. There are many different ways that we can be looking at what the causes Alzheimer's, and once we've looked at all those causes, providing various treatments for those types of patients and providing them hope. The first thing we're looking at is what are the causes and trying to get a specific diagnosis as we can. Then what we're going to do is you want to make sure that they're getting a lab workup done. We know, again, looking at the infections, looking at Lyme disease, looking at toxic metal exposure, looking to get all those things done to help provide an appropriate diagnosis. Once we do all that, then we're going to start working on how we're going to help a patient once they have the diagnosis of we're calling either mild cognitive impairment or early Alzheimer's. How can we help them as quickly as possible? So there's definitely a multi-step approach, and it's not just, okay, here's two medications and let's hope. First thing we're learning now is the two things that actually may have the best efficacy helping patients with Alzheimer's is one, exercise, especially resistance exercise. We've done a review of all the different treatments that are out there, and that has shown to have the most improvement in terms of cognition, in terms of overall skill set for patients with Alzheimer's. We also know patients who have poor sleep or have limited deep sleep or have an abnormal circadian rhythm where they're not going to bed at the same time every day have an increased risk of Alzheimer's disease. Just by doing those couple things, either preventively or in terms of once the diagnosis is made, may help that patient immensely. So that's the first thing you want to make sure you're doing. Basic lifestyle changes. Second, we know that there's a gut-brain connection. We know that patients who have anything from H. pylori to just inflammation in general, damage to the gut lining, which increases the production of a hormone called zonulin, increases something called LPS or lipopolysaccharide, that can transverse to the brain and lead to inflammation. We want to make sure that we're treating any type of gut infections, make sure that that's being evaluated. That can be it's incredibly helpful. Third thing that we want to look at, I mentioned before that we know there's now links to damage to the mitochondria. This could be from toxins. This could be linked to what's called oxidative stress, which is the increased production of what are called reactive oxygen species, reactive nitrogen species. You always are going to have a normal level of oxidative stress. You're always going to have a little bit of a mistake when you're doing something, but you just don't want that. You want that body can usually control that. You don't want that level to become extreme. That can lead to destruction of the mitochondria, potentially destruction of the nerves, and that is why we're finding that some treatment with antioxidants, things like melatonin at higher doses than you use for sleep, or even using exogenous ketones or alpha-lipoic acid or a product called NRF2 or sulforaphane, which comes from broccoli root, all those may have some benefit in helping patients with Alzheimer's. So what we're going to do is target those specific issues with the mitochondria. A substance that is derived from the gut bacteria or pomegranates is urolysine A, and that is now having some preliminary studies that shows that may increase the ability for the mitochondria to heal and limit some of the effects of Alzheimer's. So we talked about mitochondria, we talked about mitophagy, we talked about oxidative stress. We want to also increase autophagy, which is the recycling of the whole cell. That can be improved with products like spermidine. That could be help in theory with cold immersion. We would try to do things with supplementation. You also want to make sure that we're improving things like mitochondrial biogenesis, which is the development of future mitochondria. And this can be done through a lot of different things. Berberine and a lot of other cold immersion all work there. So we're going to fix the mitochondria. So we went through that. Other things I mentioned before, we now know there's potentially a link between that and insulin levels. We want to make sure that your insulin levels are controlled. You want to get it fasting insulin checked. And if the insulin is abnormal, we do want to make sure that you're on some either supplement, something like a berberine, or alpha-lipoic acid, or more importantly, something like a metformin, one of the GLP-1 inhibitors like a Ozempic or Mounjaro. Other things that we're now noticing is there's maybe a link with nitric oxide. You can simply test your nitric oxide production. You can supplement it with nitric oxide tablets. It's probably the best way. You can also use certain foods like beets to help increase the amount of nitric oxide. So that is another way that we are now finding that can help. We're going to go now into the technology that's out there. The new adaptations are really showing some really great promise in terms of dealing with patients with Alzheimer's. What we're able to do now is use things like hyperbaric therapy. Hyperbaric is high oxygen therapy. You're in a tube for about an hour. Will over time increase the amount of pressure that's in that, and that has been shown to potentially help patients with Alzheimer's disease. We can use things like red light therapy, especially specifically brain red light therapy. This can be done with either a red light hat. You could be done through intranasal red light therapy. There are really good products, Weber or Thrive or Vilite, who's done probably the most studies regarding red light, and also may help improve Alzheimer's disease. So we're talking about lifestyle, we have some supplements, we have some technologies that are out there. You want to make sure that you're working with a doctor, a neurologist who can start working on some of the medications. There are some immune stimulating medications that are coming out soon, or some of them are about to come out. There's a couple of new products that potentially are coming out in the next year or so. There's a product that came out about a year ago, and you'll have that's just not been as good, but we will see how things progress as time moves on. Having a family member or being diagnosed yourself with Alzheimer's disease is a very serious and concerning diagnosis. There is hope. There is light at the end of the tunnel. Make sure that you're working with somebody, a doctor, a holistic provider, or both optimally that can help optimize all those different facets. The lab work, your lifestyle, the supplements, the technology. You want to be doing all that combined to help hopefully decrease any symptoms that you're having from Alzheimer's and help improve your lifespan and how well you're living your life at that time. There is hope. Be patient. Be proactive in your own care. There are things out there that your doctor may not be aware of. Stay tuned for more health tips on how to optimize your health and stay healthy.